like, that's my most time.
Yeah,
Then it's
my
hard.
teacher was not interested.
Yeah, I know. It's not a great movie, yeah, but I can't get it.
You know, I like
Right. It's the experience.
you should like cover it. So like we'll go like
All our friends are going to be there.
Right, exactly. We're not really.
I mean, they're 8 and 7. So,
Well, they might be able to. As I was about 5 people.
yeah, absolutely. Daughter's already there.
Point of view. Oh no.
They're really
Excellent. How are you, Sylvia?
Oh, I'm doing good.
nice. So much.
I think Linda, somebody. Yeah.
This week, I think. Send it back. It's Kendra, mission agent.
Yeah, my oldest will be a
Did you prove it? Is he Chesterton or is he? Okay.
Yeah. I asked him because I picked him last Thursday, and I was like, "Did the seniors?"
And
They're kids. He said no. And I was like, "Didn't they?" He said, I don't know.
No, they graduated like Wednesday or Thursday.
Thank you for being so important in your high school.
We went to when my son graduated, Stephen. He was in a golf tournament graduation day, and just before they called, he came up in his golf, putting the cap in down, running down.
Are you ready?
It's like that's Stephen.
All right, if we can all stand for the pledge.
I pledge allegiance to the flag of the United States
of America,
and to the republic for which it stands, one nation,
under God, indivisible, with liberty and justice for all.
Okay, thank you all for joining us on one of the first few lovely nights of summer that we've had. Okay, if we can have a motion to approve our minutes from May, if everyone's got a chance to review and accept.
Motion to approve.
Thank you.
Second.
Thank you. Yes. Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Terry,
Yes.
Dr. Rossano.
Yes.
Thank you.
All right, next board meeting is scheduled for July 1st. Also, I don't like to bring up the topic of Carrie's announcement. I would rather live in some sort of denial and pretend like that didn't happen. But I will say, as challenging as change always is, I appreciate that you will be sticking around with us to help us with the transition. And I know that this scenario has been going on for your family for a while, and so I am happy for you to all finally be together in one home without having to fly back and forth every weekend. And I appreciate how long you stuck it out to help us and be with us for as long as you have.
Well, thank you. It's very, very hard decision.
I know it was. I know it was. I know. We appreciate you. And without further ado, we have a lot on our plate to discuss with the budget, so I will hand it over to you.
All right. The first document, I'm going to share a few things over here. I'm sorry, Demetrius. The first thing I'm going to pop up is just some budget planning slides. It's really dark. I don't know why. It's mad at me.
Well,
Goes up to
At least it's not the blue screen.
thwarting things from behind the scenes.
well.
I wish I had that kind of power, but I don't.
I don't know. It's not letting me do anything. Demetrius, do you have any suggestions? I'm going to try to open it. But I don't know.
Control Alt Delete. Control Alt Delete.
I just want to. A lot of noise. Oh my God.
I say turn it off and turn it on.
Yeah.
Usually that's my answer to I know.
Yeah.
And you know what? It works 75%.
You know what? Right.
75% of the time it works 100%.
My favorite.
Exactly.
Yeah.
Control. And I have a good success rate with that. And I have 0 training.
Ah, here we
It's
go. Sorry about that.
thing from
Sorry.
Ron Burgundy.
Yeah.
So we had a preliminary
Yes.
with our council liaisons in the auditor's office just to kind of go over our unique situation as soon as we heard about the deep cuts to the Health First Indiana funding. And so this is kind of what I presented to them. And you guys will recognize this first slide because this is the exact same slide that we went over when we talked about budget and budget planning and all the different funds that we have. So the first thing that we started with for them was explaining what funds we currently have and what the state of all of them was. So this is something that we've all been through before. This next slide shows, so we have two main funds that we operate out of. And the first one is our 1159, so that's our health general fund, and that is where our levy goes into. So our levy goes into there, this is where all of the revenue goes into, and so this is the main fund that we had operated out of always before Health First Indiana. So what I wanted to do here was just kind of show the history of this fund over the last 7 years, where we typically have started with the beginning balance, our receipts versus our disbursements, our ending balance. And then if you look at this levy rate, this shows you the rate or the portion of the levy that we have gotten historically. And so I know before when we talked, especially when we talked to the commissioners about opting into Health First Indiana, we've talked a lot about our levy rate and how our levy rate has decreased so much. And if you went back even further, you would see that there was a huge drop off in 2015 when the property tax cap went into place. Since then, this is a part of that when everything goes into Gateway and they leverage our different funding streams together to determine how much of the levy we should get. This decreases as we receive more other funds. And so this was basically just showing this to our council liaisons and to the auditor's office to show how our levy rate has decreased each year. And a lot of that is because beginning in 2020 into 2021, we got a lot of COVID funding. And then in 2024, 2025, we got the Health First Indiana funding. So we're just showing that rate increasing. This also shows that this year in 2025, we did pull personnel salaries out of 1159, which is our general operating fund, to the health department, not the commissioner's general fund, but our general operating fund. We pulled people out of there. We put them into Health First Indiana because we had to because of, again, that tax levy portion that we're getting. And so we wanted to show this because, of course, we need to be able to put people back. So I kind of wanted to explain this first. Does anybody have any questions about this portion of it? And then one thing that I will say is that we are in the middle of trying to bring in more revenue. And part of one of the challenges and barriers to that is the fact that to perform certain things that aren't traditional public health duties, per se, that might bring in more revenue, we need to make sure that Dr. Piedmont's covered, potentially some or all of the nursing staff is covered. So we first have to secure some medical liability insurance. And we actually just got an email 2 minutes ago, 2 minutes before the meeting started, from the underwriter who is hoping to set a meeting with us. So that is really good first step toward that because obviously we want to be able to bring in more revenue to be more self-sustaining. So going into budget planning for this year, we largely are working out of 1159 and 1161. We have taken a few local grants lately for bigger specific programs, but we figure that Health First Indiana and the state infrastructure budget is a 2-year biennium. So we really need to plan as much as possible on a 2-year biennium. We need to be able to know what we had left over because there was leftover funding in 1161 last year. We are going to have leftover funding in 1161 this year. We know we're going to have to carry forward some things into 2026. We're going to have to carry forward some of that money into 2027 as well. And we want to make sure that we have enough money left over in 2028. And we hope this doesn't happen. Health First Indiana would go away completely, that we would have a similar pot of money to the $900,000 that we have now to be able to ease ourselves back into whatever may come. So that's kind of the plan, to increase the revenue, to carry forward a little bit in 26, a little bit in 27, and then have monies left over for 28. So that is really all there is on this. So now I will pop up what is proposed. So one of the other things that happened in Health First Indiana in this last legislative session was that we can no longer use any money from that fund to service anyone who is not an Indiana resident. So they have to have established Indiana residency. So as you can imagine, this is an issue with students who attend our university. And that's probably the biggest thing, but with students who attend our university. And so we have to be able to service anyone in the event of an outbreak, in the event of some mostly outbreaks, but other public health matters that may come forth that we need to service the public in. And so one of the things that we did for that is to make sure that all of our clinical personnel are split between the Health First Indiana Fund and our health fund. And so that's important for that purpose. And then it also helps to get, you saw we moved from 17, we've always had 24 employees in our general health fund. We went to 17 in 2025. This will put 20.5 full-time employees in our health fund, and then we'll keep half of all of our clinical staff in Health First Indiana, in addition to a couple of the newer positions that we added with Health First Indiana. So that's where we get this value right here for salaries. So right now we're just in our general health fund. So these would be the proposed salaries with half of the clinical staff, and then the rest of our salaried personnel, with the exception of our foods clerical, one of our food inspectors, and Chris's position, and then half of Carrie and half of all the clinical staff are in Health First Indiana, and then they're all half in care. This hourly rate is for one of our part-time clerical personnel. The other two are being paid out of what we're using to replace our immunization grant, and we'll get to that. This is the FICA and the medical and life insurance for all of those individuals, and then PERF as well. The medical services agreement is Dr. Young's contract that we approved the renewal of. We're doing
2 years ago.
Yeah, sorry. Okay. Uniforms and supplies. These are this is office supplies. So this is a small amount of office supplies that we need to support some of the work that we would do outside of the 1161. So it's a very small amount of office supplies.
But I just want to point out that, Carrie and all of, the heads of the department have already, have worked a lot on this budget. And if you start looking at 2025 to 2026, they've all been working on how we can make cuts. So if you see already that is showing up, and we're going to see more of that. But I just want everyone to be cognizant of the work that they've done to get us to this point in making those cuts so that we can maintain as much as we can in terms of personnel.
Yes, so that is really important. We did look at everything. What did we spend in 23? What did we spend in this line item in 24? What did we spend in this line item in 25? What inflation has occurred, and what do we need to put here that this is going to be very lean, but that we can make work for next year. So uniforms and clothing is that to replenish uniform. We have a lot of field staff who are out in the field on a daily basis. And that's one of the ways in which they are identified, as well as the nursing staff with increased outreach, just to allow our staff to have branded clothing. The other supplies, just one second, I'm going to pull something up really quickly. Okay, those are things for the clinic room. I apologize. It took me a minute. So like juices, snacks if somebody's feeling lightheaded, suckers for the kiddos. We give out popsicles sometimes as well.
Sure.
So that's what those are for. Medical and dental supplies, again, this is just that small amount. So the majority of our medical and dental supplies come out of 1161. This is that small amount of medical and dental supplies for TB testing. So chest x-rays, we pay the state for those, Tuberosol, run the skin tests, those kinds of things. So again, we can service students at BU who may not be Indiana residents, for example.
So this wasn't necessarily zero last time. You're just moving it around so that we're able to have it accessible to us without.
Yes, we just moved $9,000 of what we need for medical and dental supplies into here, so we can make sure that we're
ruining the stipulations that were given to us with the HFI.
Exactly. Shop supplies, we have a small amount, the amount that we need for inspection supplies in 1161. This is Dave's hourly. Training and education. And again, as you will see, we kind of went through all of the regular trainings that we need for pretty much continuing education for all of the staff to complete their job, and this is the amount that we came up with. Travel associated, we really are going to try hard not to do overnights next year, but just in the event that something comes up, there are still meals and incidentals that are occurred anytime somebody travels out of town. And I would hate to just not have anything here and then run into something where we are not at an opportunity where we can reappropriate. Telephone, this is not telephone, this is all of our hotspots that we use. So anytime we go out in the field, Foods and Environmental all have a hotspot that's Wi-Fi that goes along with their computers, and there's just for outreach. And that's what those are for. Our postage machine, of course, as you know, we send a lot of vital records. We get requests online. We send a lot of those through postage. All of our food applications, same with pools, tattoos. We send out all the permits unless somebody comes and gets them in person. The postage is split really evenly between here and 1161 because we do use a lot of postage. So between like $3,000 and $5,000 a year. UPS, we have spent a lot less money in shipping to the state this year. However, we have some news that the staff courier are they ending services on July 1st? So only Wednesday pickup after July 1st, and we send things nearly every day. So we are going to need to do the shipping via UPS down to the state. So it was nice. Well, it was a great thing. We didn't take it away because we weren't sure how it was going to work, and we haven't used it much this year, but we will need it for next year. Jumping down to the bond, this is Chris's bond for being a notary. Equipment other than vehicles. This is one. I don't want it to be wrong. So small equipment. So that's putting a little bit of money in there for small equipment should we need to purchase any small equipment that we're not thinking of. So that's kind of like that's a contingency for that in there. Contractual services is Dave's contract. Other services. This is where we send all of our water samples from beach testing, and so we sample the water of all the public beaches in the summer, and we have to send that for bacteriological testing for E. coli, and that is the money for that. And that sums up our general health budget. Does anybody have any questions about any of those things, or what alignment is for, or why, or so we pull down here. So now this is the Health First Indiana budget, our local public health services fund. We already talked about the salary, so this is half of Dr. Guimont, Carrie, Jess, Tara, the nursing staff, and then Chris's position, a food inspector, and our foods clerical staff. This hourly is our intern hourly pay, and then the FICA, the medical life insurance per the all go along with that. So this is where the bulk of our office supplies come in. So as you can see, we had a lot more money allocated last year to office supplies. We did buy a lot of vital records paper last year because we knew that the price was going to go up. So we really loaded up on that. And so again, we looked at the budget, what we have left of everything, how can we run office supplies. So this and then the small amount that was in 1159 is where we felt that we needed to be with that. And again, it will be tight. Other supplies in here. I don't know why I'm struggling with the other supplies. Okay, so those are for cleaning supplies. So for our asthma and our lead programs, when we go out and do a home assessment, a trigger assessment, things like that, we need cleaning supplies for what we are doing those, or to have some to recommend to a family that's really having a problem, and that's what that is for. This is the bulk again of our medical and dental supplies. We purchase all of our vaccine out here. So travel vaccines, things like that. Shop supplies, so these are all the inspection supplies that Foods and Environmental use when they go out into the field. Many of those need to be replenished, so test strips for sanitizer, um, thermometers don't last forever, unfortunately. The mirrors, they look underneath things into the ice machine with, and then as well as some of the things that environmental uses that they have to replenish. And we have some money for travel in here. These telephones are the Wi-Fi's that go with the vital records. So if you'll remember, part of Health First Indiana is that we have to be able to provide vital record services without interruption during a public health emergency. And so we have dedicated computers and printers, laptops and printers for that. And then this is the Wi-Fi that for those computers. We're paying that out here. The other half of our postage. This is the small amount for printing if there are things that we need to print, and the print shop is down. We did print our annual report this last year, and so I think that would be really nice if we get to that point and we're able to do that again. That would be a nice thing to do, as long as everybody was okay with that. This is our advertising budget. So again, this is much leaner than what we have had for advertising. What we will need to do is sit down in December and look at everything that we did to advertise this year, pull an ROI on that, and decide this is what we're doing and this is what we're setting right now. And so that's what we'll be doing for advertising. We've tried a lot of different things because we have never really advertised before, and so now it'll just be really important to sit down and look at all of that and decide what are we getting return on investment for. We have money in here for liability insurance, and we'll be honest, we have no idea what the cost of that is going to be. If we're able to put it on the county's plan, how much in addition does that add? How much of it is that something that the commissioners would be willing to take on? But we don't know. We haven't had any of those conversations because we don't know. So for right now, we have this amount of money in there for that. These maintenance agreements are things that we have to pay for each year. So the Fine Health, the agreement for our foods and environmental inspection program. Our CLIA waiver, that's every 2 years. Our copy machines, our postage machine, we have to actually run the machine and load with postage. And then we have a new translation service that we went to. We had done Musligo and we were paying a monthly fee with them. We actually discovered another company that other health departments were using where you can just pay for what you use. And so we transitioned to that, and it has brought those costs way down. So that's been really nice. Vehicle maintenance and repair. Most of our vehicles, so the Equinox, the truck, and the Traverse, all go out to the sheriff's garage, and that is all covered for maintenance on those. Our mobile unit, we are not able to service. So we have to take that to an outside garage, and we have found a wonderful garage. And so we just need to make sure that we have money in here for that service. It does not cost nearly as much, knock on wood. We did blow a tire one time, and we had to have somebody from LaPorte County actually come because nobody else can get it in their door. And there is a garage that actually will service that on site. We did that at the fairgrounds. And then where we take it for the regular maintenance and check over oil change, our generator has to have its oil changed and has to be maintenance every year. It's really a general place. We have a great deal. So we found a great deal. So hopefully we would not use nearly as much, but just to be prepared. Dues and subscriptions, we subscribe as a health department to NACHO, the National Association of Accountants and Health Officers. And so they have a lot of training opportunities when they're members of NACHO. They keep us updated on things. They have the health officials call on a regular basis. They have a lot of times when we are going through things, they're having national calls about it. And so it's really nice to have that. There's a message board. We also are members of the chamber, so that gives us a lot of exposure and a lot of opportunity to network. And there are a few other associations, like Indiana associations, that the different departments belong to. And so and again, just helps with networking, knowing what's going on with legislation, being in a group where we go down and we maybe talk to legislators, and then also also a lot of free opportunities for training, whereas when they extend it beyond that, you have to pay for the training. Let me see what other services there are. So we had just a little bit of money in there for testing for individual private wells. So basically, as you'll see, the hardship fund has gone away. This is just a little bit we stock back for the event that something happens and somebody really needs private well testing in the event for lead or something like that, and they really can't do it. This would be something that we can help them out for. So if you scroll down to your capital outlays, there is some money for data processing equipment for. Oh, I apologize. That's Findhelp, Fetch, Bluebeam, GIS. That's our GPS navigation system. I think we're here in maintenance agreements. Yes, and then the others were what we talked about with the maintenance agreements. So the data processing equipment's all of our software agreements. Transportation. This is our agreement with the Porter County Council on Aging. And that's the only thing remaining in that line item. So you will add some other things we were doing for transportation. So when planning for these types of things in our distribution, what it came down to was looking at our local level KPIs. So what is it we said we're hoping to move the needle on over the next 3, 5, 10 years? And what do we need to do that? In addition to our needs assessment and those biggest things that came up on the needs assessment. So for some of our local level KPIs, those are things that we're doing our ASMA program that we are trying to get the word out about. Largely that's in-house, that training's done. We'll have some other supplies that will go toward that. Increasing our immunization rates, that's all stuff that we're going to do boots on the ground. The chronic disease prevention, we're going to need to put some money here. The other thing that came up a lot in our needs assessment was the transportation piece. And so we feel as though that, and I know you guys discussed it because it was approved at the last meeting for the Porter County Council on Aging. It's just such a unique transportation experience where it's a door-to-door transportation where no one's like that, and we've really been able to help them. So as far as the other programs, we did leave the same amount of funding in the areas that, again, speak toward the chronic disease prevention and then our trauma and injury prevention with the suicide prevention. But again, those will have to come up for review each year, and it may be that the board decides that money is spent better differently in that area. But those programs were left in here, so the Portage YMCA, because again, we approved it and it goes into next year. This is some work towards suicide prevention, some RAD and some other things for trauma and injury prevention. These are some of those programs for out into the community, again, for chronic disease prevention. Student health, these are our student meals. And then the Powers Health is the reducing undiagnosed diabetes initiative. So do you have any questions about those things?
Those are all the things that we've been working on the last few years. So that's kind of how they were decided upon in terms of what we feel like we've gotten our best return of investment on it. Does anyone have anything?
I'm just wondering, that was the contractual services that was 500. Oh, 21,000 last this year, but
That was for the remodel.
oh,
Yes. So that is a very large amount.
because that's a giant shift.
In 2024, 2025, we were able to set aside 10% of what we received for Health First Indiana for capital improvements. So all of that went toward balance of the remodel. So as you'll remember, we got $1 million bond. Sorry, not $1 million bond, $1 million in ARPA funding. The build out was done over at 155 Franklin, so that voters could move. That was $55,000. We had 945 left. The build out was done for the old voters, and so then we had to cover the balance of the remodel, and that is what that money was from. So those were our 10% that were held back. So we will not be having to hold over 10% of our $905,740.44. So thank you for asking, because that's a huge one.
And what was under maternal health and the Purdue extension that are going away?
Yes, that's a good question. So with Purdue Extension, we had some agreements for a couple of program deliveries. So Matters of Balance was one of them. it was an 8 week. It was twice a week for 4 weeks or twice a week for 8 weeks of spin classes. I apologize.
I think that sounds right.
And then there were also, we were going to work together on some healthy eating programs. So the Battles of Balance, it required training somebody to become a master of balance, which Annetta from Purdue Extension did do, and she's run some of these classes. Her last class actually was a pretty big success, and then the healthy eating classes have just now started. It took a long time for their contract to get in place, so it actually ran September to September. And that is something that we had been talking to Annetta about. There's some changing circumstances with her. I don't want to speak out of turn. And so that is something that we were hoping to finish out and get to September with. And we can absolutely look at other offerings that they have and maybe move some of the stuff that's just in general in chronic disease prevention if we want to go back and partner with Purdue Extension on some of those. Did that answer your question?
And the maternal child.
Yeah, because they have and then in maternal and child health, again, there were a lot of programs in that area that really we just never got off the ground. There were some talk about wanting to see about a lactation consultant potentially that we could work with, that we could maybe pay for mamas in need who needed a lactation consultant. Associated Peds has a lot of great programs, but you have to be patient of them. So we even had talked about possibly talking to them to see if we could help them to extend that. And we just hadn't gotten to it when the funding got pulled, or we had started to get in talks and nothing had gone anywhere. And so then we just kind of had to take a step back.
So it was budgeted but not used.
Correct.
Okay.
Correct.
The sheriff's program is listed here.
So that
Is that it for that?
Yes.
Okay.
yes.
You have to tell them.
Yes. And again, that's it's
We can't do it all.
discussion. So
Yeah.
Oh yes, and I didn't talk about that. So our spend plan was due to IDOH only for this fund by June the 1st. That can be changed multiple times, as many times. As a matter of fact, I have an email today about needing to do something to it. But so that is not set in stone. It did have to be sent to them, so we did meet that June the 1st deadline as far as getting our first plan. But all of this is up for discussion tonight, and then hopefully vote, or we do have to submit it. I have to turn it into our county auditing system. They get back next week, and then we have to schedule meetings with council. They're starting to have those preliminary meetings, so this is all due in to council by July 1st.
And what's NWH screening? You go to
Northwest Health.
Those were the Northwest Health screening services. We had an agreement with them as far as groups who were indicated for a screening that weren't barriers that we would cover that. So
There's a lot of good programs now, really, that are pretty accessible, I think, to patients, even those who are underinsured or don't have insurance. I feel a little better about this one because there's things that the community provides that can pick up the slack that we may not be able to do with these screens. That you walk into any hospital and they have their signs now, $59 for this, and so I think those kinds of programs will replace this.
many of them are better prices.
Yeah, than what they were that they were charging us, for sure. There's that too.
We do have a meeting, though. We do have a follow-up meeting regarding this. I think it's next week. Just they were wanting our feedback, and so
and if you scroll down, student health is what?
Food.
these are
The meals
So
provided?
and the weekend backpack snacks. We also had some money in here in the event that we needed to help them with curriculum. And Jamie's really she's been working with schools, if you want to speak to this more, but truly as far as if we truly unified curriculum that we needed to be able to extend to all the schools, it would be extremely expensive. And more than anything, the things that they're coming to her for, we're just able to find evidence-based programs that then we're able to deliver and not have to spend a lot of money on, investing in licensing a whole curriculum and getting it into the school.
And the food is still so much unknown. I mean, there's still so much still swirling around about what the federal government is going to help subsidize in terms of school lunches and the backpack and weekend programs. So I think we felt that as much as we can afford to keep in that line, I mean, for me, priority is to feed the children before anything else.
Is it summer also?
Summer, oh yeah, and the weekend backpack. And then, I mean, my concern is too, if there's some school systems where the entire school system gets that, and if those are lost, that's not going to come close even to help those scenarios out. So I was hoping to keep as for me that food was a big priority to be, if there's anything I'm going to start with is feeding children.
And that was one of the things that actually came up in the needs assessment. I
Yes.
was surprised. I don't know why. Shame on me, but I really was. And the need in the summer is actually, I shouldn't say the need. The requests in the summer are a lot less. I should not say need, but truly the requests in the summer are a lot less. But going back into next school year, Portage Township has actually, requested a weekend program, and I don't feel the numbers are all as far as they do require families to sign up to request that they want it, and it is much lower than their free reduced population, but these families need this help.
I think we were told with that needs assessment anywhere between 1 out of 3 to 1 out of 5 children in our county suffer with food insecurity. And the number one cause of poor performance in school is hunger. So, this is a big deal.
And like at one of the charter schools, it's snacks that we're helping the kiddos that are in the nurse's office that are starving, So it's not the weekend meal that they're taking home or anything like that. It's just helping her to have snacks for those kiddos.
Is the difference in the fixture furniture, is that also from the build?
Yes.
The new things you bought? Okay. That obviously you're not going to be buying again.
Correct.
Okay. Okay.
Don't break anything.
Yeah.
Our new motto is before. I do want to. I'm sorry. There is more to the budget. So as you can see, these were the legacy funding. So this 1168 and 1206 is the legacy funding. When we were opting into Health First Indiana, we always talked about if we don't opt in, we'll receive our legacy funding. That's what these two funds were, and they were not removed. We still have money in those. We will be spending them to zero by the end of this year, and that was always the desire, of course, of the state was that we spend those to zero and then roll that into Health First Indiana. This donation fund were donations from sponsorships that we received from the health fair last year, and so we're using those funds toward the health fair and those things that they sponsored. So their name were on them. They sponsored them last year, but because of the way we have to receive and appropriate monies, we didn't have it in time to receive it and appropriate it for. So we're using it for those things this year as it was donated for. The next fund, as you will see, is the public health emergency preparedness grant. So this is the grant that funds John and Jeff. We do not at this time know what that is going to come in at. It starts on July 1st. We do not know what it's going to come in at this point, and we may not until after July the 1st. But this is, as you'll see, there's no 2026. And at this point, we've been using it all for contractual, but in knowing, what we know now about our funding and the laws, we are going to want to look at the way that we're going to use that funding. So we'll be talking about that. For our immunization grant, we will not be getting an immunization grant in 2026. So instead, we have COVID monies that we still had in the form of COVID immunization and COVID testing grants. And so kind of what we did is we looked at our immunization grant and what we need to operate in that area. So what we would typically use to operate lead in that program to run run the 317 and the BFC program. And this is what we came up with between the immunization and testing grant. These monies we will again be able to do this next year, use up the rest of immunization, move into testing, and then still have a little bit left over. So that was kind of our plan for that monies. So this hourly are the other two part-time clerical staff. We pay out of there, and of course their benefits. Small amount of office supplies. This again specific to immunization, so print off this, things like that. Medical and dental supplies. You can't do any vaccine out here, so even those immunization grants, and this is Band-Aids, alcohol swabs, cotton balls, that kind of thing. This is the Public Health Nurses Conference, and then for maintenance agreements here, we can do our UMR, and that we pay that out of there, as well as agreements for if any of our vaccine refrigerators or freezers go out, the maintenance for that. And so we just have some other supplies down in here. If we would have to replace any equipment, which we hope that we don't have to. And again, if this doesn't get spent, this testing grant is just available for next year, and then anything that's left for the year after, we just have it appropriated in case something would happen, because it does take a month to get on council's schedule to reappropriate funds, and so this way we have it if we need to spend it, and if not, it'll just be there for next year. And then this is storage. So we do have a storage unit that we pay rental on that has PPE in it. We do keep a lot of our other storage in there as well. So we, like for instance, we have a lot of reusable bags that we buy as part of advertising. So we just keep a little bit that we need here. We store some other things out in the storage. This next fund, the Workforce Development Co-op grant, is our school liaison grant. And so this is Jamie. And then also for next year, a part-time person that we share with tobacco. She works in the schools underneath Jamie, and so that part-time pay is in there as well. The lead grant has ended, but we ended up with $537 extra because of something we had paid for, right?
Don't use it all once.
Yes, I know. So we will use this for cleaning supplies for lead or any other kind of supplies that they need when they go out for testing. That's the only thing we can use it for. Once that's gone, we'll close that fund, and then our tobacco grant. 30th.
So again, I think we've discussed this before, but we used to have to fight for grants all the time before HFI to help cover the gaps. And then when HFI was implemented, all these grants kind of went away because they said you now have HFI. Well, now they're cutting HFI and there's not the grants. So it's like a double cut on both ends. We have to become more creative and work harder in terms of like people like Chris that we have to kind of dig and find, and all the opportunities locally and elsewhere to help find those grants that we hope will kind of come back up as.
And she really is. And even
I know.
past, it's like, oh, we missed the deadline for this, but you can still see them. And so
We know.
ready to mark it on the calendar for next year, and then going after. And so we just found out today that we got a GEMIS grant. And so that will help. So we wrote specifically, so we're trying to write specifically for some of the local grants for programs that are great programs that we've started that we still want to be able to support. So for this one in particular, we'll support more low-med kits. So we will be able to continue that program, and then some Safe Center expenses as well. So for Kendra's Safe Center program as well.
So she's immediately pivoted, to look for as the person who's in charge of our grants, to instead of it, how do we figure out how we're managing HFI requirements? Now she's looking for all these things to continue granting these funds.
And we were asked to apply for the First Things First collaborative grant.
Good.
Together with Mental Health America, so we have a meeting next week to talk about that one. So that's going to be an extremely competitive grant. They have 23 applicants. They asked 11 people to apply. They're giving them 3.
Oh wow.
So
And what's that one for?
it is the First Things First. It's a collaboration grant, and so what we put in our letter of intent was safe sleep. So Mental Health America has a program where they go into homes and do some home visiting, and Alyssa Sills with Mental Health America is a safe sleep educator. And so it was a partnership where we helped her to facilitate some pack and plays to these moms that needed cribs for kiddos to sleep in. But this was an expansion on that to include our car seat program. So we do have a grant. Kendra and Antonio are car seat safety technicians, and we do have a grant where we get car seats from the Criminal Justice Institute. Is that correct? But they are the convertible car seats are rated down to birth, and so no infant car seats. You know, you have these babies that need to come home from the hospital. Parents are looking like,
Yes.
my baby in that their head, and
Yeah.
so we had through Health First Indiana been providing through referral from the hospital infant car seats, and so we're hoping through this to be able to continue to do that with her education and her ID tech. So it's all trauma and injury prevention for the pre to 3, which is what First Things First focuses on. They would like to see us deeper and have a more comprehensive program that's informed by the results from our peer team, and so that's what we're meeting, so we kind of get together and figure out what that looks like. So,
Are you meeting with Mary Jane?
so with we've been talking with Mary Jane and we got her on board, but this will be a meeting between us and Mental Health America for writing the grant. Question? Line items there.
Is that all? It's not as painful as I thought.
No, no, there aren't as many.
It's a lot of pain to get to this point. Questions, concerns? So are we at a place for a motion?
Yes.
To approve the budget for 2026? We can entertain any of those.
I moved to
Second. Thank you.
Dr. Watson,
Yes.
Dr. Brooke,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Terry,
yes.
Dr. Rosanna.
Yes.
Well, team, we've been through a lot in the course of these last couple. Lots of this, lots of this, a lot of work, a lot of ups and downs. But I have faith in this team that we will forge on and continue the excellent work that you guys provide.
We can do it.
Any old business? Okay. Report of our board attorney.
Madam Chair, a couple of matters to bring to the attention of the board, one of which I'll be asking for some action, and the other one is for informational purposes. The board has had an agreement with Dr. Young for many years. We've dubbed it the Medical Clinical Consulting Contract. That means she runs the tuberculosis clinic. She does an excellent job. The staff confirms that work with her, and come before you tonight and ask that the contract that will expire on June 30th of this year be renewed for an additional period of 2 years, which is traditionally what we have done with Dr. Young. She not only does an excellent job, but she does it at a very reasonable rate in terms of compensation for her.
Oh, yeah.
She'll be paid under this agreement, and as she's been paid in the past, no change, $16,800 over the 2-year period, and that interprets $700 for 24 months. Any questions, I'd be happy, or one of the staff can answer them. I think I can speak for the staff when I say that we're very, very fortunate to have Dr. Young, and we greatly appreciate her role in dealing with something that a lot of people don't think exists anymore.
Right. No,
And
she's
that's
kept busy.
Tuberculosis, it does exist, unfortunately. Any questions? I'll be happy to answer them. Otherwise, Madam Chair, I would ask that you entertain a motion from the board to approve a new 2-year contract with Dr. Young as described.
A couple things. First of all, I read an interesting statistic. Even during COVID, more people died of tuberculosis across the planet than even of COVID. So that's kind of an interesting statistic. That being said, I could have swore that we voted for her contract last year, or maybe I'm just that I've been around here that long that it's been 2 years since we last approved.
Time flies when you're
Because it stuck in my head because we did for the first time.
Years.
I don't know.
that was the first time we did a 2-year contract.
Yeah.
Asking to do that again.
Again. Okay. Wow.
And that was the
Fine.
first time she had ever received an increase in salary after being here for how long, helping us. And so I reached out to her and I said, "Are you good?" She's like, "I'm happy to continue on." So I'm like, "Oh, thank you." We're, I mean, this doesn't even cover her malpractice for Pete's sake. So, but I know my years have all blended into one to know when we did that as well. So, and she's a very, very busy, very in high demand physician. So we are truly lucky to have her. I mean, she managed the hospital's COVID response. I mean, she's a force to be reckoned with. So
Motion to approve.
thank you. I second.
Dr. Foster,
Yes.
Dr. Brooke,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Hassan,
Yes.
Terry.
Yes.
Okay, thank you. The second matter on my agenda, although it doesn't appear in the minutes, is for informational purposes. We have had an increase over a period of time here of both the media and the public being more interested in how our restaurants in Porter County do in terms of our inspection program. And up to this point, what we've done is handle these requests on an ad hoc, one-on-one basis. But it's apparent to us that it's going to grow. There's going to be more requests for this. So we're thinking about an alternative way to proceed. And that involves a publication of some form on our website of all the restaurant results. And there are communities and counties throughout the country who do this regularly. I was in Orange County, California not too long ago, and they have little placards with a score and a grade that they put in the front window of every restaurant. This is a B minus or this is a C plus. We're not looking for that type of competitive scoring.
Why not?
But we are looking at the options. We're not ready to bring anything to you, but I wanted to alert you to the fact that Dr. Bloxham and Carrie and Susan and I have been powwowing on this,
Dr. Guimond.
and it's getting some momentum in-house anyway. And it may be something in the next couple of meetings we'll want to bring to you to implement later in the fall, so that people can go to the website and get this information themselves, as opposed to us dropping, because when they come in, of course, they want us to drop everything we're doing and answer their question. This way, they can get that. We can refer them to our website. They can get that information, and we can continue doing what we're doing. One of the things we need to be careful of is we don't want to be perceived as being on a witch hunt for restaurants, but on the other hand, we don't want to be perceived as hiding or protecting from the public, and that's a delicate balance sometimes. But I think what we're modeling at this point is a fair middle ground that hopefully the restaurants will see that they're comfortable with that, and our constituents as well, who can gain more information. We are in a transparent society, and information is the magic name for everything. So, but anyway, happy to ask any questions anyone has. I may have to say that's not answered yet, but we're working on it, and we thought it should be brought to your attention. Susan, do you have anything to add?
You like that plan? Yes.
The
So
heavy
that's
lifting,
important.
The
Comes
heavy
from them.
Heavy lifting will be done by Susan.
For sure. Yeah.
But we're here to help.
I think too, if anyone has not had an opportunity to shadow one of them when they do one of these site reviews, it's really eye opening, and there's a lot of minute detail that they are looking at, which is fantastic. But I think it's nice if we do it this way in the way Dave described, that we get to present the information with the knowledge behind it and the reasoning behind it, as opposed to if someone comes and asks for these results and if they write something about it or post something about it on Facebook, it's their interpretation of these results, whereas I think it's better if we're in control of that information and how it's presented, so that people understand if there's this infraction noted, is this, it's not the end all be all, or it is an end all be all, or all those types of things. And so there's so much information with each thing. I think it's important that we have the opportunity to describe those, if there are infractions and things of that nature, with it being in our control of how it's described.
That's the game plan, and hopefully we'll bring a complete program to you in the next couple of months and run it up the flag and see if anybody salutes, right? Unless there's anything else,
No,
Madam
that's great.
Chair, that's the report from your attorney.
Thank you. Claims and receipts, we were ahead of the game before the meeting started, made its way around for all of us to sign. So if we can have a motion to approve our claims and receipts.
Move to approve.
A second?
Second.
Thank you.
Dr. Watson,
Yes.
Dr. Brooke,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Hassan,
Yes.
Terry.
Yes.
Thank you. Reports of committee, staff, and health officer.
Well, as sad as it is for me to say, we do have a hiring plan, a hiring panel for interviewing, as well as a rubric, which I'm happy to share and email to all of you if you'd like to see that, who's on the panel and whatnot. So we've already started receiving applications.
Oh.
And, so.
I guess that's a good problem to.
Right. So we'll be looking at all that in the next coming weeks.
I was just going to remind everybody tomorrow is our Project Adam drill, exercise drill. So hopefully 10, 15 minutes tomorrow or something, we will be receiving our Project Adam certification for the administration folks. So that's really exciting.
And our health fair.
And our, oh yes, the health fair is Friday. And then the ribbon cutting, did everybody see your invitation in the email for the ribbon cutting? So mark your calendars for that as well. We're really excited. We are showing veterans and coroners as well. They're going to all participate.
Oh, that's fun.
Basis. And so you might see an invitation around to that has all three of our that's what will go out to the county and things like that. So I'll pass it. Do you guys have anything else?
I continue to love all the they just get better and better. There's pictures, it's dynamic. I love it. Okay. Any public comment?
Don't everyone speak at once.
We have one, I think. It's great.
Before they can have a comment, there's got to be
They're watching Zootopia. So it is. I mean, I would be to the movie. Okay, well then if we can have a motion to adjourn. And we will
Second.
Okay. All
Our
right.
executive session is scheduled for 6:30, which is in 3 minutes.
We can